Welcome to the What's Happening Birmingham video podcast.
Good morning, everyone. This is Jarvis S. Scott. What's Happening Birmingham? Today I have the honor and pleasure of being with Dr. Celeste Reese Willis. She's a local doctor here in the Birmingham area. Today we are talking about a very important topic, but the first question I want to ask you, did you get a good night's sleep? Or did you have trouble getting a good night's sleep last night? If you answer yes to any of those questions, you may have a symptom of sleep apnea.
Yes.
So I got it right. So Dr. Reese Willis is here today to kind of tell us a little bit more about this condition and everything. So Doctor, good morning.
Good morning. Thank you for having me.
Thank you for coming on the podcast. So tell us, what is sleep apnea?
Okay, obstructive sleep apnea is a condition that exists. Most patients will present with symptoms of loud snoring. Sometimes they'll have excessive daytime sleepiness. They may have problems with memory or problems focusing or concentrating and fatigue. But the actual mechanism is that your airway, your oropharynx, it's the partial or complete obstruction of that area while you're sleeping that causes the patient to wake up gasping for breath or to have loud snoring.
What are the normal, I know you said symptoms, but what percentage of Americans actually suffer from this?
Well, there are about 22 million Americans that suffer from this each year.
Why is it so common in men?
Well, some of the risk factors for sleep apnea include being obese or being overweight, having a large or thick neck or tonsils, having hypertension as a risk factor, using sleep medications as a risk factor, as well as alcohol use can be a risk factor. So sometimes in men tend to have thicker necks. Some men are obese or overweight, and so these are some of the risk factors that you have to look into to figure out who it is you should be evaluating.
And what I saw online was it was like two types of this condition.
What do you mean?
Well, it was two types. It's kind of like one where it was like CNA. I hope I pronounced it right. And another one was, it was another type. It was like two different.
Oh, well, what that's saying is that when you get the partial obstruction, there are two different areas. One is a central one that that's the central nervous system, and one is a more localized one. That's what they mean.
Okay. So once a person kind of get diagnosed with it, what's kind of like the next steps as far as like the treatment?
Well, everyone that we suspect has sleep apnea will go to their physician. They'll sign you up for something that's called the sleep study. With the sleep study, they will place electrodes over your head as well as having a sensor or electrodes on your heart as well, so it can measure what's going on with your cardiovascular system. And after the sleep study or during the sleep study, there's a technician that watches, and they're able to record and find out just how many episodes of apnea that you have wherein you stop breathing. At that point, they'll review it, and they usually will recommend that you are on a Cpap Machine, which is a machine that causes gentle pressure across your oropharynx to help keep it open. You remember we talked about the partial or complete obstruction. That gentle airway pressure helps to keep it open so that you continue to get good amounts of oxygen while you sleep, because what happens with apnea is that there's a decrease in the blood oxygen levels while you're sleeping, and that causes strain on the cardiovascular system. So the main way that it's treated is with the Cpap machine. In addition to that, some physicians will encourage patients that are overweight to lose weight, and that will sometimes help with the symptoms. However, if you do have sleep apnea, you can't expect, I'm overweight, I'm just going to lose weight, and that will fix it. If they tell you that you need to use a Cpap machine, I encourage you to definitely use it.
I saw someone online where they was talking about a home testing method. Have you heard of that?
A home testing method for sleep apnea. There are some more advanced technological ways that they're investigating, whether someone has sleep apnea or not. That's something that patients have to see their physician and find out if that home testing is something covered by their insurance company. That's a newer method.
So it's a newer method. I want to go back because maybe somebody's probably watching, probably their spouse, and I think you mentioned something about snoring.
Correct.
At what sign is it normal snoring and it's like, okay, well?
Well, what tends to happen in people that have sleep apnea, the bed partner is able to hear them snoring, but if you actually sit there and listen, they'll be able to hear and see, oh, you sounded like while you're asleep, you stop breathing, because they'll gasp for air because their airway's completely closed, and that causes a trigger to your central nervous system, and it causes you to wake up kind of gasping. And so the bed partner is able to determine, they can actually hear it a lot of times, especially when sometimes you'll have even people that have really large tonsils that may not be obese or overweight, but they have really large tonsils that are causing that kind of airway obstruction.
All right, another thing I saw online was this is actually like blood pressure was kind of linked to high blood pressure.
Yes, for sure. One of the risk factors for sleep apnea is definitely having high blood pressure. If you have sleep apnea and it's uncontrolled, it can actually cause you to develop high blood pressure. I'll explain the mechanism a little bit about what happens to cause you to have that strain on the cardiovascular system. When you are snoring, you have that partial obstruction. There's a decrease in the blood oxygen levels. Your heart or cardiovascular system needs the oxygen in your blood to function properly. So when you have those low oxygen levels, it causes a strain on the heart and causes an increase in your blood pressure. As a matter of fact, people that have sleep apnea are at increased risk for having heart failure by about 130%. There is a 60% increased risk of stroke, as well as a 30% increased risk of cardiovascular disease for untreated sleep apnea. So it's a very important condition.
And I'd be remiss to mention too, I saw that it was about like if you get up in the middle of the night and have to go use the restroom a lot, is that kind of like another warning sign, you think?
Not necessarily. It's not listed in medical literature that is. But the restlessness of sleep is very characteristics for patients that have sleep apnea. Having restlessness, in other words, people that don't sleep completely through the night, they can lay down and be in the bed for 8 to 10 hours and wake up feeling like, I still feel tired. I feel like I'm sleepy during the day. And one of the reasons why it's so important as well, it can serve as a form of job impairment for people that, especially truck drivers, or people that drive for a living or have to drive long distances because they're sleepy or have daytime fatigue, they're more likely to feel like, oh, I need a nap in the middle of the day. And so those are things, motor vehicle crashes as well as job impairment, as well as crashes that involve 18-wheelers have been linked to patients that have sleep apnea. So it's a very important condition.
Okay, now another thing I guess if people are watching this, I guess they're thinking in their head is like, how many hours of sleep do you supposed to have at night, or what they're suggesting normally these days?
Well, generally 8 hours of sleep is considered normal.
Okay, I know what's supposed to I do like 4 or 5.
Right. Now and a lot of us don't practice that, but that's what the literature states: 8 hours of sleep.
Well, I like what you mentioned earlier about exercise and why it's so important, because once you exercise, it's going to make it easier for you to fall asleep and different things like that. Is there anything else you want to add about this new condition that's kind of like you've been seeing?
Well, the only thing that I would encourage you to do, if you have been told by your bed partner that you snore or snore loudly, or that you gasp when you're asleep, because I will say this, snoring is the primary symptom, but not every single person that snores has sleep apnea, and not every single person that has sleep apnea will present with snoring as the main symptom. Sometimes it's just they wake up and they're just not really fully rested, and that sometimes will trigger your physician to say, hey, we may need to do a sleep study and make sure that you don't have sleep apnea. So the main thing that I would share is, if you've been told by your bed partner, or if you know that you snore loudly, please make sure that you see your physician for an evaluation to find out if you need a sleep study. If they tell you need a sleep study, go ahead and schedule it. Go ahead and have the sleep study. And if they determine that you have sleep apnea and they suggest that you need a Cpap machine, I encourage you to use it. A lot of times there are patients that will say, oh, I don't like it. It makes me feel claustrophobic and all those things. But it's amazing how much better their quality of sleep is once they actually get into the habit of using it.
Yeah, I saw a picture of it online. Like it's like a little mask.
Right. It looks like a Darth Vader mask.
Yeah, like a Darth Vader
people compare
mask.
it to that. Yeah.
Okay. Now, there's any other like side effects to wearing that mask normally?
No, there are not generally side effects to wearing it. We do discourage patients that have sleep apnea from heavy alcohol use or using sleep medications, because those are things that make you even more sleepy. But other than that, no. Sometimes people will complain of, oh, they just have to become accustomed to it. So sometimes for people with seasonal allergies, they may have a little more nasal congestion. It's just a matter of making sure you're on your regimen for your seasonal allergies, and most people do fine with it. But the Cpap machine will save someone's life. I will tell you that.
Okay, and I know you mentioned about sleep medications. Do you feel like that if you got to take sleep medications, that should be a sign that maybe you should go see the doctor first before you're trying to get yourself on the pills to make yourself go to sleep?
Oh, for sure. To figure out if there's something else that's going on, for sure. But generally your physician, when you see them, if you're seeing a physician saying, hey, I'm having problems with sleep, they usually will, do a little assessment to figure out if you're someone that needs a sleep study.
All right. Well, I'm here at one of the facilities where she's located at. Can you kind of tell people the real importance of seeing a primary care doctor before we end the podcast?
Oh, do you mean just having regular medical exams?
Yeah.
Okay, sure, by all means. It is important to follow up with your regular doctor, especially, I will say one of the biggest things that I usually encourage my patients with is knowing what your history is and knowing what your family history is.
Okay.
If you have family history of heart disease, if you have family history of high blood pressure, that means that you are someone who needs to make sure that you keep up with your regular visits. Even if you don't have family history, you need to keep up with your regular visits and have evaluations to, screen for diabetes, screen for high cholesterol. In general, most insurance wellness physicals today actually screen for high blood sugar, high cholesterol, with an annual visit. Most insurance companies at this point require it. As a matter of fact, some people can get lower rates as a result of completing a wellness visit. That's something you'll have to check with your insurance company about, but that's something that we do on a daily basis. But there's a lot of power in knowing and having that knowledge, because if you know that you have family history of heart disease or high blood pressure or diabetes, then you know that you have to be careful with things like, if you know you have family history of diabetes, you need to be careful with eating sweets or eating a lot of carbs, and making sure that you exercise and making sure that you're screened on a regular basis to make sure that you're not diabetic. If you are, let's enter into a treatment plan or regimen.
Okay.
And that doesn't always include medicine for diabetes, high blood pressure. It's just a matter of knowing the numbers.
Okay, and finally, I'd be remiss if I didn't end this podcast and tell people a little bit about yourself.
Okay.
So why you got into medicine and things like that.
Okay. Well, again, my name is Dr. Celeste Reese Willis. I began my career in medicine about 1996. Ooh, I'm aging myself. So that was a little over 20 years ago. Started medical school, did residency here in Birmingham at Caraway Hospital, and have worked in the community here for the last 14 years. Initially got into medicine because I had an experience with a mentor that allowed me to shadow him and watch him treat patients. It was an orthopedist in Montgomery, Alabama, Dr. Flagg. I'll never forget it. And watching him treat people with fractures and just kind of watching what he did at a young age. I think I was only 15 at the time. And it just resonated with me. And I said, oh, wow, that's so neat that he gets to take this x-ray and look at this person's leg. And I watched him, make a little boy go from crying to feeling better in a matter of 30 minutes by casting his leg. And so while I did not obviously go into orthopedics, it was something that resonated with me as far as the benefit and blessing that you get and what you feel like when you aid a patient in feeling better. And so that really resonates and speaks with me. And so that's why I initially got into medicine. But as you delve into the career, you get exposed to different aspects of it. And I ended up going into urgent care because I started during residency doing urgent care medicine. I started working for American Family Care when I was in residency. And so it just stuck with me. And so I loved the dynamic of seeing a patient that's having cough and cold symptoms one minute, the next minute seeing someone that's diabetic or has high blood pressure, educating them on that. The next minute someone comes in, they have a laceration, sewing them up. The next minute someone has an abscess. The next minute it's a child that has, a Lego block stuck in their ear. Just all of that just really resonated with me and stuck. And so it's something that I've enjoyed doing. the last 14 years.
All right. Well, we definitely thank you for taking time to come on the podcast.
Thank you for having me.
Dr. Willis, this is a very important topic, and most important, go see your doctor if you have any of these symptoms. Just don't, like the slogan I always say, what you don't know may kill you, but what you do know will save your life. So,
true. That's true.
So thank you all for watching the video today. Please check out what'shappeningbirmingham.com for more videos, and don't forget to subscribe to the YouTube channel. Thank y'all again, and have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.